Hi and welcome to Healthy Living. I'm Debbie Lyons here today with Kelly Presnell, who is in charge of PR and marketing here for Hilton Head Hospital. We have a great show to talk to you about.
We do. We are introducing Dr. Shelley Ringer on the show today. She's a breast surgeon, fellowship trained breast surgeon who relocated to the area just end of 2014. So we're excited she's here. She's happy to be here. To join our breast center, which is, nationally accredited breast center, the only one in the area, which is so important for women who have concerns about, breast health.
What are we going to talk about today with Dr. Ringer?
I think she'll talk about just, general breast health, the importance of, annual screening mammograms and what she does and what they do here at the Breast Health Center to care for women who may have breast cancer and who don't have breast cancer, because they see both women conditions.
And it's what you always say, when we do shows like this, it's talking about breast health.
Yes.
So let's talk to Dr. Ringer.
Right.
No one likes to wait, especially in any ER waiting room. I mean, when I'm sick or my family has a medical issue, I don't feel like waiting around with a lot of other people. Not to mention they're sick too. Honey. And my family does not wait patiently. You can imagine how uncomfortable and how long it can seem. But then I found out it doesn't have to be that way. I can check in online and wait anywhere I want. What's not to love?
It's the smarter way to ER at Hilton Head Hospital.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hi, and welcome to Healthy Living. I am here today with Dr. Shelley Ringer, and we're talking about breast health. And it's been fun for me. It's the first time I've actually got to interview you, and we're doing a little bit of where did you grow up? And I did not realize you were an Indiana IU girl. Grew up in Indiana.
Midwest, yep.
Talk to us a little bit about your background.
Sure. So I grew up in South Bend, Indiana, and everyone says, did you go to Notre Dame? And my response is, I don't want to go to college where I could run into my parents at the grocery store.
Good point.
Wasn't for me.
Who knew?
Yeah. So I went down to IU Bloomington, loved it, stayed there for med school, which was actually in Indianapolis, and then did a general surgery residency training in Cincinnati, Ohio, at a private hospital, Good Samaritan there, and then did a year of specialized training at UPMC in Pittsburgh, specializing in breast cancer treatment and breast disease overall, not just cancer, but also just overall breast care.
And I know that's part of what we're going to talk about today. You have two little ones.
I do.
Yes, and a handy husband. She did say that.
Yes, I do.
What's your husband's name?
Jeff.
So Jeff, there you go. She says you're very handy. But let's talk, if we can, about women and breast health in general. I find that I'm 61. At 61, in my 30s, I thought about my breast health because I was having kids.
Yep.
Okay, and then I sort of took a lapse, and now at 60, I know that it's even more important now because I think instances of breast cancer rise along with age.
They do.
There is
Correct.
a correlation.
Exactly.
So let's talk, if we can, about breast health throughout the decades, if you don't mind.
Absolutely. And so what people don't realize is what's good for our heart and good for our overall body is good for our breasts too. So maintaining a good healthy weight, being active as much as possible, eating good healthy foods, more vegetables, less processed foods. We all know what we should do.
Correct.
It's just hard to do it in the busy, active lives that we have. And so all of that is good for breast health in addition to the rest of your body.
Talk to me, if you will, about the breast in general. I think many of us think we know, but don't really know a lot about how it works, if you will.
Sure, absolutely. So some things that people are often surprised to find out is they're told when they're young, when they're 20s or 30s, that they have dense breast tissue, and that's very true. But it is something that changes over time. So that dense breast tissue is the glandular tissue that is there for breastfeeding.
Okay.
And so when you're young, your body's ready to have children and breastfeed. As time goes on, especially once women hit menopause, the glandular tissue actually goes away, and that typically makes the exam much easier to do and definitely makes a mammogram much easier to read. So it is something that changes over time. Those changes over time are felt on exam and seen on mammogram. So as stuff comes up and people say, well, wasn't that there before? It's that the tissue itself does actually change over time.
Is that hormonally based?
Exactly, very much so. So that's why menopause is the main time period where the tissue goes away, as those hormones go away. Now, with that being said, women who take hormone replacement will often have the lumpy, bumpy tissue and the dense breast tissue of younger women because the estrogen is still there.
So dense breast tissue isn't a good thing or a bad thing. It's simply a function of your body.
You got it. Exactly. It's just how we're made. And for 20-year-olds, that's just the standard. That's just a given.
When do you recommend a young woman begin doing self-breast exams?
I think it's a good idea to get used to your body as young as age 18 or so. And it's not so much that we're worried about finding something as just getting used to your body and how it's made and knowing how to do a breast exam.
And actually, I have 3 kids and my 2 daughters. It was just so that they knew or they paid attention in case there was anything that was ever different.
Exactly. Yep, to know changes. And that's sometimes what's more important than anything else. And I listen to people when they say, this wasn't there before.
Okay.
Yeah.
What are some of the things that we may not think about? We're talking about breast changes or breast health throughout the decade. So that's really the 20s. We're just sort of getting used to things and paying attention. Now we're into the 30s.
Yep. Again, just that the breast tissue does change, especially as women have children, breastfeed. The shape of the breast changes, as many people know. And again, kind of the lumpy bumpiness, and everything's continuing to kind of evolve.
When you talk about actually, before we were talking about how we really want to gear the show, and we were talking about it's not simply about breast cancer. It's about any kind of breast issue or disease. What are some of the things that I may not think about?
Absolutely. So I see a number of women with breast pain, which is not typically a sign of breast cancer, but can be quite irritating and bothersome to people. Breast lumps in general, it is not uncommon to find a breast lump. And of course, every woman's first fear and concern is going that I have a breast cancer, although the majority of breast lumps that I see do not end up being breast cancer. At different ages, they can be varying things. I've seen young women with breast lumps, 12, 14. It's not uncommon. It is very rarely a cancer at that point, but it can definitely happen. So part of what I want people to know is that breast lumps happen, and it does not necessarily mean that there's a cancer. It is something that should be checked out, but it's not necessarily a cancer.
Can you talk to me about the genetics of breast cancer?
Sure.
Because I know as we get more sophisticated in our testing and just our knowledge about our breasts and about the genetics, I find a lot of women that I talk to are like, do I get tested for the gene? Do I not? Am I more predisposed to having breast cancer? Am I not? Can you tell us about how all that works?
Absolutely. It's a wonderful question. And the genetic world is really expanding. It's really interesting. So of all women in America, only about 1% have a gene that causes breast cancer. So it's a very rare gene.
And is that gene cause breast cancer specifically or make you more prone to generalized cancer?
So it is a number of things. So it will increase your risk of breast cancer, although doesn't guarantee you will get it, but it is a very high risk factor for it. But it also increases your risk for other cancers, ovarian cancer. It's a common misconception that men, if there's a gene in the family, don't need to be tested, but they do.
Oh, I never thought about that.
Because there's also an increased risk of prostate cancer and colon cancer, and obviously they could pass the gene on to their daughters. What we're really also finding out, so traditionally we've known about the BRCA genes. We are just within the past year or so finding out that there are so many more genes that we kind of knew about but didn't really. And we're really testing for a lot more genes than we used to. And there are a lot of genes that can influence a woman's risk of developing a breast cancer and other cancers. Depending on the specifics, there are other cancers that could be at increased risk. And so we're really testing for a lot more things. But again, it's a very small portion of who should get tested.
Let me ask, is all breast cancer created equal? In other words, is breast cancer, breast cancer, breast cancer? A daffodil is a daffodil is a daffodil?
It depends how you're asking the question. So
Okay.
yes and no. For genetic testing
I like
wise,
that. Yes and no.
yes and no. Depending, so for genetic testing, breast cancer is a breast cancer is a breast cancer.
Got it.
For an individual woman and their treatment plan and what it means for them,
Got it.
completely different worlds. And I often tell people that when they are diagnosed with a breast cancer, that when you go out and start looking, it is really scary.
Okay.
And you hear the words, and it seems like it truly is one disease,
Right.
and it's not.
Okay.
It truly is. There's the non-invasive form that's very early, and that's very different from someone where it's spread to other parts of their body.
Got it.
So the words are the same, but they're not necessarily the same. But from the genetic standpoint, if you're looking at that,
I gotcha.
it is. But for each individual woman, it's not.
What I hear you say is every person is unique and every person's treatment will be different, and that's why it's so important to have a professional team that works together.
Absolutely.
I know here at Hilton Head Hospital you all have a pretty incredible breast center.
We think so.
Talk to me a little bit about that.
Absolutely. So we have a center that combines myself as the surgeon and the radiology department right in the same building, and behind the scenes the exact same place, and it really
It's pretty
allows
impressive walking through here.
Good. It really allows us to collaborate and provide quick services to patients. If I see someone and they need something, they can pretty much always get it right away, which is amazing.
Dr. Ringer, why is it so important to have a collaborative group or a group of different professionals?
Yep, definitely. It just provides better quality of care for people. So, and I was also going to mention, any woman who is diagnosed with a breast cancer, here we have a tumor board. They
wow.
get presented, so there are multiple different doctors who take care of breast cancer patients, and everyone gets to state their opinion of what they think the best treatment is. And someone may think of something I haven't thought of, or vice versa. And in that way, playing off of each other, talking about different things.
Spirited discussions.
Exactly.
I love that.
Yeah, absolutely. And I think it's really best for the patient. Any clinical trials that might be available for people, and just making sure everyone's on the same page and having lots of opinions.
We're going to take a break here in just a second, but when we come back, I'd really like to talk about what part the patient plays in her treatment. I should say his or her treatment.
Yep.
So stay with us. We'll be right back again with Dr. Shelley Ringer talking about breast cancer here on Healthy Living.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice. I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here at Hillhead Hospital.
We are back here on Healthy Living. We're speaking today with Dr. Shelley Ringer, and we're talking about really breast health in general. Right now we're talking specifically about breast cancer. And if you just joined us, the question was posed, how can we as patients help you do your job? What do you like us to come armed with? And how can we be our own advocates?
So having family information, so any cancers in the family, that's definitely helpful because that can help me determine if genetic testing is needed or not.
All right.
And just being involved. There are some things where I will kind of say, hey, this is our standard, and there's not a whole lot of options, but there are options that women have, and I am a strong believer that women get to make that choice.
Okay.
When I meet with someone who is newly diagnosed with a breast cancer, I spend an hour or so with them, going through everything, and it's interesting.
Are we overwhelmed at that point?
Absolutely.
Yes.
Do
you recommend we bring another set of ears?
Yes. Thank you for bringing that up. Absolutely, because it's overwhelming. It's a ton of information.
Okay.
People almost invariably feel better after the conversation, but it is a lot. So I do always recommend bringing someone or lots of people with you. I'm happy to have as many people as want to listen because different people will hear different things. And so I've seen women who unfortunately have had a cancer diagnosis years before and have another one, not common, but happens. And before they were kind of told, here, dear, this is just what you do, and weren't really explained anything. So I really go through, what this means, what the options are.
Okay.
And when women have options, I really try to empower them to know what's right for them. And what's right for one person is not what's right for another.
All right, we touched on the internet before, and I guess I am a little bit of information sometimes is very damaging. So if when I come and we're talking, can you give me lists of, let's say, if I want to go research a little bit more,
Yes.
some sites that you would recommend?
Absolutely. And so when I do see a woman with a new cancer diagnosis, we have a whole binder that we hand out. One piece of that piece of paper in there is a whole list of websites that I personally have vetted and are good and accurate. It is difficult when you first get diagnosed to get on the internet because, again, we talked about how breast cancer is seen as one thing, but it's really not. And when you don't know where you fit in, it's very scary. The other thing is, people who aren't happy are the ones who post on the internet.
Of course they are.
Yes. So the women who did well and are doing fine,
you're not hearing from them. They're living their lives.
Exactly. But so I typically do recommend that people wait until after they talk to me to go on the internet because then they know where they fit in. They have the background knowledge that I've given them to say, I've heard this and this is me, it's not me, and they know more what to do with that information.
I told you my son was a radiologist and does a lot with mammography, and he always talks to me about breast cancer being a chronic disease. And oftentimes it's horrible that you have a cancer at all, but that it's a very manageable disease.
Absolutely. So I always say I couldn't go into a field where people didn't go okay. That's just how I'm made. And even if you have to tell people, hey, it has gone to other parts of the body, we don't know that we can cure you. We can manage it, and that's exactly what I tell people, that our goal at this point is to turn it into a chronic disease, and we oftentimes can. People live very good quality life. It's still there, but they still get to live their lives, and that's our goal. Our initial goal is to cure it, but when we can't, there are so many options of how to take care of them at that point.
Are treatment protocols and interventions exponentially changing? Is it still about, tissue is the issue, get it out? Are you doing a lot of more prophylactic kinds of things too?
It's kind of all over the place. So I would say
yes,
exactly. As far as our treatments, what we're really focusing on, and I was recently at an international conference in San Antonio, and the main focus is finding out what cancers have that's different from normal cells
Okay.
and attacking those. So getting targeted treatment. And so we're really working on that. And the more we can find targeted treatment, the more tolerable those treatments are, the
Makes
better
sense.
they will be. So that's definitely part of our
For
goal.
example, what would that look like? What would a targeted treatment?
Absolutely. So one broad example of that is a lot of women's breast cancers grow in response to estrogen.
Okay, all
And
right.
we have medications that are essentially anti-estrogen. They can lower the amount of estrogen in a woman's body.
Is that like a tamoxifen that we've heard about?
Exactly.
Okay.
That's one of them. Yep. So by doing that, it can literally starve the cancer cell of estrogen and cause it to die. So that is a targeted treatment specific to the cancer. Now, that's not as targeted as we would like,
Okay.
because obviously there are tissues
Sure.
and parts of our own body that need that estrogen. So we're going steps even further than that to find specifics to the cancer.
When we talk about treatment interventions, and that brings up a good point, benefits and risks, do you sort of go through that whole sort of synopsis with us so that we...
Absolutely, absolutely. And you brought up kind of the prophylactic. So there are women who are at high risk to develop breast cancer that I will talk to them about medications that can lower their risk. And absolutely we go over what's the benefits of this, what's the risk of this, and do we decide what we want to do. So again, when you talk about how do you be your advocate,
Right.
you know, going through all that and giving people the time, you have time to go home and research this. You don't have to make a decision immediately.
Really?
Yep.
Because I keep thinking that once the diagnosis is made, time is of the essence, time is of the essence.
And from an emotional standpoint, absolutely. People want it taken care of. But there is time to...
Do it right, do it once.
Exactly. That's exactly it.
I mean, that does make a lot of sense.
Yep.
Are you seeing, all right, are you seeing breast cancer in a certain demographic, certain age? No.
All over the place.
Broad spectrum.
Broad spectrum.
It used to be 1 out of 9 women. What is it today?
I mean, I think it's 1 out of 8. Yep.
Okay.
It is, it's high.
Are
It is high.
we seeing breast cancers and diagnosing them earlier? Are there environmental factors that are contributing? Are
Yes,
we just,
and yes, and yes.
Yeah.
So overall, the incidence of breast cancer is actually decreasing. The main reason for that is once we found out that the hormone replacement treatment that we thought was going to protect every woman's heart, and unfortunately doesn't, and does increase the risk of breast cancer, a lot of women came off the hormones at that point in time. So because of that, we're seeing lower risks of breast cancer from that.
Got it.
So
Interesting.
that is actually decreasing. Unfortunately, it is a broad spectrum, and I do see a lot of women who say, but I have no family members, how did this happen? And unfortunately, that's no guarantee.
And so there's no real, you can be genetically predisposed, but what is the correlation between families? If your sister or your mom, how does that work?
So there's kind of a couple different realms. There's if you have a gene that can increase your risk, and so that's fairly high. Then there's where you don't have a gene, but family members have it, whether that be mom, aunt, other people. And you're at high risk, but not as high as if you have a gene. The closer a woman is related to you who has a cancer, the higher your risk.
Got it.
And overall, it makes us more worried the younger that woman was. So
okay.
if your grandmother had breast cancer at age 90,
Right.
that makes me less worried. If your mom had breast cancer in her 30s, that makes me more concerned.
All right, so let's say a woman has breast cancer in her 50s and she has 2 daughters.
Yep.
All right, what are the recommended ages for mammography, and is there anything that they need to be doing again to protect themselves?
So that's a great question. So we recommend that mammograms start 10 years younger than a first-degree relative when they were diagnosed. So if mom was diagnosed at age 50, then we would recommend daughter start at age 40, which for the most part is our standard recommendation anyway.
Okay.
In our practice here also, between myself and our nurse practitioner, Cecilia Paramijo, we also do high-risk monitoring. So for those daughters, we would have them come in, we run specific risk assessment on them and their specifics. So I can't say a generalized statement, but we go over, everything specific to them and then talk about here are your risks. Is medication a good idea. Should increase monitoring, sometimes using breast MRI, is that needed? So we can do that. And then we'll often see women once or twice a year to do a breast exam, to examine them along with their other doctors to keep an eye on them.
Is there any correlation between having children and breast cancer?
There is. So having children lowers your risk of developing a breast cancer, and at younger ages. Although there are things that are associated with developing breast cancer, they're all essentially related to the amount of estrogen exposure your body has
Darn
had.
that estrogen.
I
We
know.
love it, but
we do, exactly. Our skin loves it.
Our skin loves it. But anyway,
absolutely.
Dr. Ringer, it's a pleasure to talk with you. I appreciate you
Good to
taking
see
time
you.
out of your busy schedule. We want to thank all of you for joining us here on Healthy Living. Have a great week.